This is Dr. Christopher Sundy with Nova Health Recovery Ketamine Infusion Center. I'm going to discuss ketamine therapy for seasonal affective disorder. So, what exactly is seasonal affective disorder? It's been known that the changing of the seasons alters our circadian rhythm and alters our sleep-wake cycles, and it's associated with increased depression and low mood in some individuals. Some people may notice that every fall or even in the summertime for some people that they start to feel very depressed. And they used to call this the winter blues. And so effectively we have some individuals who get full depression as a result of this. And they basically suffer for several months where they are having difficulty with a number of different domains of functioning. And seasonal affective disorder, SAD as we otherwise put it, is not really a different disorder than depression per se, but rather has a seasonal component to it that can last 4 to 5 months. And basically, it has the exact same symptoms as regular depression, but it's just seasonally based. And for some people, and the majority really, it's in the wintertime, but some people have summertime depression. And so for diagnosis, depressive episodes have to occur during specific seasons, whether it's the winter months or the summer months, for at least 2 consecutive years. And classic symptoms of SAD, seasonal affective disorder, are the same as major depression, which include feeling depressed most of the day, nearly every day, and losing interest in the usual activities you enjoy, and experiencing changes in appetite, weight, insomnia, concentration difficulties, feeling sluggish or agitated, low energy, hopelessness, worthlessness, or frequent thoughts of death and suicide, which are exactly the same as traditional depression scoring. But for wintertime seasonal affective symptoms, there's also other aspects to it, like excessive sleepiness, hypersomnia. So people just basically lay in bed all day long, as well as overeating, especially a craving for carbohydrates. And then there's weight gain as well, and social withdrawal. They just feel like hibernating. Now, for summer seasonal affective disorder, some individuals will have trouble sleeping with just insomnia. They'll actually lose weight because of poor appetite. They'll have anxiety, restlessness, agitation, and even episodes of violent behavior. So the risk factors for seasonal affective disorder are younger individuals who have a higher risk, and generally between the ages of 18 and 30 is the higher episodes of seasonal affective disorders. Women are more likely to get seasonal affective disorder by fourfold relative to men. Those with a history of depression or bipolar depression will also suffer during seasonal changes. And then the distance from the equator, so the further north or the further south you are, the higher the likelihood you'll get seasonal affective disorder. And if there's a family history in particular, then that also increases your risk. So why does seasonal affective disorder happen? So basically there's felt that individuals with this disorder have difficulty regulating the neurotransmitter serotonin. And that is believed to be one of the reasons for this occurring, and that 5% of people with seasonal affective disorder have more SERT, a protein basically that's involved with serotonin transport. And so as a result of that, there's lower levels of serotonin in the synapses, and this results in depression. There's also been noted to have an overproduction of melatonin, resulting in increased sleepiness. And so with this decreased serotonin and increased melatonin, there's an impact on circadian rhythms. Vitamin D is also believed to play a role in serotonin activity, and vitamin D deficiency and insufficiency definitely are noted in the winter months because of lower sun exposure. But low vitamin D may also predispose a person to seasonal affective disorder as well. So we can measure depression by the traditional PHQ scoring or the Hamilton Depression Rating Scales or a number of other questionnaires, but there's also a seasonal pattern assessment questionnaire that includes a number of different domains, and this could be scored in as a measure of improvement or decrement in seasonal affective disorder. This particular questionnaire can be very helpful in just following individuals along. And it basically goes through a number of different domains, including socialization, mood, weight gain, appetite, energy level, sleep, and a number of other factors as well that are measured to assess the severity of seasonal affective disorder. So what are the treatments for seasonal affective disorder? So certainly antidepressants that are SSRI based have been effective, in particular Prozac or fluoxetine, as well as bupropion. Wellbutrin is also an effective medication for treating seasonal affective disorder, especially when it's started early. So individuals can start a few months in advance of the season, and it can be actually prevented potentially by the use of bupropion. And also bright light therapy or phototherapy, which is basically using 20 to 60 minutes of exposure to 10,000 lux of cool white fluorescent light daily, can be very helpful in diminishing the symptoms of seasonal affective disorder and depression. And then vitamin D, improving the person's vitamin D levels may also help prevent some symptoms. Cognitive behavioral therapy has been effective, as well as yoga, walking, exercise, and mindfulness. So certain lifestyle changes certainly can be very preventative. But how about ketamine? Ketamine is highly effective and rapid acting in seasonal affective disorder. Again, this is just another form of depression. And there is also a loss of neuroplasticity. And ketamine has been shown in numerous trials and a number of meta-analysis to be effective as a rapid acting antidepressant. Um, Effectively, a series of ketamine infusions can improve depression ratings or even cause remission of depression in up to 70% of individuals. So 6 infusions over 2 weeks with approximately 3 infusions per week, like on a Monday, Wednesday, Friday scheduling, can get a person out of their depression rather quickly. Now, ketamine can also make your underlying medications work better and faster. In some prior videos, we've discussed ketamine being utilized with Lexapro to basically augment the effect of Lexapro and make it work faster and better. And we also see this with other antidepressants as well. And also, you will need maintenance infusions, so every 3 to 4 weeks potentially, or even more frequently when a person is suicidal or severely depressed or having problems with cognition or just general functionality. And so frequent infusions sometimes are necessary, but for others, just the initial series and some home-based therapy may be effective for them. So this is kind of a case-by-case basis. As we know, the person will get better as the season goes along and the daylight hours get longer. Now, home-based ketamine as nasal spray or oral tablets, troches, ready-to-dissolve tablets can certainly be very helpful as a maintenance therapy.